My name is Kate Henderson, and I serve as the Regional Hospital President at Ascension, Texas. In addition to leading strategy and operations for 4 of our Ascension, Texas hospitals, I also manage our strategic community partnerships for our healthcare system. I'm so honored to welcome you today, as I know it will be an enlightening reflection on community mobilization during Winter Storm Uri. As we know, late in the evening on February 13th, Winter Storm Uri swept across Central Texas. For more than 5 days, our communities experienced record cold temperatures and power outages that significantly impacted our day-to-day lives and work. Millions of Texans went without power or water, some for days with sub-freezing temperatures. At Ascension Seton hospitals and healthcare facilities, as you might imagine, these weather conditions caused significant challenges. While the ice of Winter Storm Uri has since melted away, many are still grappling with the fallout. And beneath the grim headlines, we've also witnessed an incredible outpouring of support as our community began coordinating disaster relief services and finding ways to help each other. Ascension Seton hospitals and caregivers quickly operationalized to manage and resolve issues related to the winter storm, also during an unprecedented pandemic. With our emergency response plans in place, we were able to provide uninterrupted patient care throughout the duration of the storm at each of our 14 hospitals and most of our more than 100 clinics. I personally witnessed so many of my fellow healthcare colleagues make sacrifices to ensure that our patients continued to receive uninterrupted care. This included watching our nursing staff walk to work with their overnight bags and their sleeping bags in hand, as they knew they'd be sleeping in our hospitals for days on end. This included watching our providers in between their shifts, delivering food and other resources to our hospitals, including picking up their teams so they had safe transportation to work and then moving them between our sites so folks had a break in between. This includes our lead Dell Children's neonatologist, a provider of care to the smallest among us, driving the distance in extreme winter weather to save a premature baby, a baby born at 24 weeks gestation in Marble Falls. And he needed to grab his own vehicle equipment and 2 of our nursing staff because ground and air medical transportation was not possible during that winter storm event. Our Ascension Seton associates went above and beyond to provide exceptional care for patients during this difficult time. And our community stepped up to provide significant support as well. Many, so many from our community quickly rallied to provide more than 17,000 meals and staff and more than 50,000 bottles of water to our hospitals across Central Texas. And we are so thankful. I know on Wednesday night, after sleeping several nights in our Kyle, Texas hospital, Ascension Seton Hayes, I had the blessing of greeting one of the manager of the local Chicken Express. She had called in 4 of her chefs in overnight. The restaurant was closed, but upon hearing that we needed help feeding our staff because we were reserving our food for our patients, she called 4 of her chefs in at night, and they made 250 chicken meals and delivered them to our hospital around 7. It's just one of many blessings I had a chance to personally observe. Now, the winter storm will undoubtedly be remembered for years to come. And while the situation has improved, many are still facing substantial issues. Now, healthcare heroes is a phrase that has been used more in the last year than any other time I can recall. And I do believe it to be fitting. In fact, the Webster Dictionary definition of a hero is a person admired for achievements or noble qualities, or one who shows great courage. And that certainly fits many of our community members. That said, I doubt that most or any of us chose our line of work or did what we did with the goal of becoming a hero, but rather I bet our passion was more about being a helper, one who assists or gives assistance to support others. The famous Fred Rogers, or Mr. Rogers, from the well-known PBS show, would often talk about his mother's advice to, quote, look for the helpers in times of disaster, and noted that there are so many helpers, so many caring people in this world. Today, we have the opportunity to celebrate the caring individuals and organizations who stepped up to support each other and to identify actionable steps to ensure that all, particularly our neighbors who've been pushed to the margins, have the resources they need to prepare for, respond to, and thrive in the aftermath of future emergency situations. We're so pleased that you're joining us to hear from our panelists as I reflect upon the role of community mobilization in response to this event. Thank you for being here. Thank you for your time, and welcome.
Good morning, everyone. Judy Maggio here with Austin PBS. I first want to say a giant thank you to Kate Henderson with Ascension Seton. That was such a beautiful way to frame our topic today, because we're talking about leading where you are, community mobilization during disaster. And your team at Ascension Seton certainly did mobilize and show the best of us. And you are those helpers that Mr. Rogers with PBS talked about. And we appreciate all the sacrifice and dedication and kind of a glimpse behind the scene to everything that you all did during this terrible time of our winter disaster. So thank you so much, Kate. Thank you so much to all of you for sharing a little bit of your time with us this morning for the Leadership Austin Engage series. I have just a few quick reminders before we get started and meet our wonderful panel. First of all, this is an interactive conversation. It's called Engage Breakfast. We want to hear from you. Please leave us your suggested questions in the comment section of this live stream. We are going to be shining the light today on some of the great grassroots leaders on the ground, helping people get much needed supplies and shelter during this winter disaster. The freeze obviously is just one of many crises we've had to deal with during the past 12 months. And I have a quick plug to put in because many people have been living through some mental health issues due to all these crises. And I want to invite everyone to watch our next ATX together on Austin PBS, because we're going to be tackling the issue of mental health during a time of crisis. And that's Thursday, March 18th at 7:30 in the evening. We'll be looking at ways we can all help each other with our own mental health and what help is available and what help is accessible. So now let's get on with our Engage program for today. I am honored to co-host these monthly discussions with Leadership Austin's Courtney Bailey. So Courtney, I want to turn it over to you now.
Sorry, I was muted. You think I would know by now, so I unmute myself. Thanks, Judy. So for those of you just joining us, I'm Courtney Bailey, and I lead the Engage series for Leadership Austin. And before we introduce our panel, I would like to acknowledge that there were so many people who showed up when our community needed them the most during this winter storm. We saw neighbors helping neighbors. We saw people opening their homes up to strangers. And we even witnessed local community groups expanding their capacity to respond to the immediate needs of those most vulnerable. Today, we are simply highlighting a few of those efforts, but we also want to say thank you to everyone who stepped up to be of service to their community and to each other. Whether big or small, your contributions and leadership made a difference. So thank you. And with that being said, I would like to introduce our panel. So first we have Janice Bookout. She's the co-founder of Community Resilience Trust. Next, we have Daniel Garrissey joining us. He's the executive director of Austin Disaster Relief Network. And we also have Sister Christina Mohammed. She's the national coordinator of the 10,000 Fearless First Responders, and she's also a member of the Black Leaders Collective. And finally, we have Susanna Woody. Susanna is the president of the Del Valley Community Coalition, and she is also a member of the Austin Latino Coalition. Thank you all for joining us this morning, and welcome. And so now I'd like to ground us by having each of you briefly tell us about your organizations and your involvement in the community mobilization, both during and after Winter Storm Uri. And I will start with Janice.
Thank you. Well, first, I want to acknowledge my whiteness and clarify that even though I co-founded Community Resilience Trust, I can't speak for CRT because CRT is an intentionally diverse collective of leaders from many perspectives, and we intentionally prioritize the lived experience. So I just want to clarify that. Community Resilience Trust was founded by myself and Ruben Cantu on March 14th last year, 2 days after canceling the Earth Day Festival, which I direct the new nonprofit behind that. Having worked 6 previous disasters, what was clear to me was that disasters amplify systemic inequities, and in particular, structural and institutional racism. And institutions fail in disasters and community groups rise to the occasion. Ruben at the time was asking the question of how to make Austin the most equitable city. And so we formed CRT to address those inequities in the short term, and then use that opportunity to dismantle inequities and build our resilience as a community long term. And since then, we've done a lot of work to shift the power and funding structure together with a lot of different groups that have come to the table, and really following the lead of people who look like and live life like the population served. And then Uri was coming, and at the urging near Urban League, we convened a group in a project that was ready to take action. And so we listened to the direct lived experience of our unhoused, and we started there. We were able to collectively, with lots of other organizations, supported the housing and providing hot food to about 400 unhoused individuals into hotels. And then we moved to the general population. We served about 20,000 hot meals, 20,000 cases of water. We ran 2 distribution centers, served, I think, 20 apartment complexes, and then some individual homes as well. And continue that work to some extent, supporting some other organizations who are continuing. So it was our privilege and honor to serve in that capacity.
Thank you so much for sharing, Janice. Next, I'll go to Daniel.
Yes, well, the Austin Disaster Relief Network is a network of nearly 200 Greater Austin churches and thousands of trained volunteers. So when disaster strikes, we're able to mobilize quickly in times of crisis. We work very closely with the city of Austin, all the counties, of course. What we do is we provide short-term and long-term support. So we're there to the very end when those people get back into safe and clean homes. So far to date, what we've done with Winter Storm Uri is right from the very beginning, the great need for shelters was the first deployment for us, putting volunteers into shelters, raising up managers to run shelters. Little did they know they'd even become cooks for their volunteers because we couldn't get food to the shelters, at least the city couldn't in the early days. But that quickly rolled into forming a fleet of 4-wheel drive vehicles because there was such a great need, whether it was an emergency worker needing to get to work, a nurse needing to get to work, or even people in their homes that were beginning to get cold and they needed to be brought into warming shelters. That fleet grew up to about 400 vehicles, and we ended up dispatching over 600 people, individuals, family, baby formula, you name it, whatever the need was. Those four-wheel drive vehicles were dispatched and deployed. Just an amazing, heroic effort of the community coming together to love their neighbors, right? This is what it's really all about. Well, that rolled into the need for shower units and laundry units, where we placed them all over the greater Austin area to make sure that those that had no water still were able to actually take a shower and do their laundry. And then in the background, we had a survivor hotline that was launched to be able to start meeting immediate needs, whether it be informational needs, prayer needs. You know, there's a lot of emotional, spiritual care that goes on behind a disaster. But we ultimately launched an 800 number for people that needed cleanup in the greater Austin area. That includes all 5 counties where perhaps they had their pipes burst and they needed someone to muck out their home, to actually cleaning up debris. And finally, to plumbing repairs, which has become a really big thing right now in the Austin area. Fortunately, we're working with a group called Water Mission and Plumbers Without Borders. They have brought in, today we have over 20 plumbers going to residential homes and repairing their pipes for free. Our job is to help coordinate those plumbers to them and make sure that they get the jobs that we're pulling off the website from all these work orders of people calling in. To date, we've had well over 750 orders come in, and probably about 90% of those work orders, I believe 80 to 90%, have actually been taken and grabbed and claimed. So a lot of work going on behind the scenes. We have over 41 churches on the network. They're actually doing the cleanup and mucking out with the Samaritan's Purse. And so there's a lot of activity going on. So a lot of people starting to get at least somewhat getting back in order. And then where we're heading now for the future is that we, this Friday, we're giving away nearly 26,000 pieces of new clothing from Uniqlo, who we're partnering with. That's going to be a big event this Friday for survivors that have been impacted by the crisis. We've been reaching out to all those that have actually called into the call center and hotline numbers and all that. We're also beginning the process of intake to hear the stories of survivors, meet their emotional, spiritual needs, and also provide immediate needs like gift cards for those that lost all of their refrigerated goods, to supporting people get back in the rhythm with their bills, because a lot of people found themselves shorted in their funding because they lost a whole week's worth of work. And so we're having to either support them with those finances to pay bills right now. And then we're also preparing for the big job ahead of us, which is the repair, rebuild of homes. And that's probably going to take 1 to 2 years to be able to reach every person out there. And there's a lot of coalitions actually in the city of Austin, like Urban League and others. They're doing an amazing job in preparation for that also. So together, I think, we can do this together. No longer can we as one organization do this alone. These disasters are so big that it takes just not only our government, but it takes, the churches, it takes the community, it takes organizations to work together to meet every emotional, spiritual, and physical need. So that's a little bit about what we're doing.
Thank you, Daniel. Sister Christina, would you like to briefly share your involvement and about your organization?
Absolutely. Thank you all so much for having me on again. My name is Sister Christina Muhammad. I am the coordinator for the 10,000 Fearless First Responders, and now also a partnership with Black Leadership Collective, Austin Urban Area League. We're partnering up together. We have been boots on the ground. The team that we have, so phenomenal, excellent. We focus on people that look like us, right? We focus on pretty much everyone. We help everyone, but our focus and the lens is making sure that our people are, they're situated, they're fine, they're okay, and our people are not okay. So when we first started off, before the actual storm started, working with people that are homeless, people who may not have a place to go, and making sure we got them off the streets. We've been working diligently since then. We've been feeding our people every single day, making sure our people have water every single day, going in door to door, checking on families, making sure that they have what they need, mucking up, doing the same thing, mucking up, making sure if anybody has any damages in their homes, we can be available for them. And just briefly, we've given over $50,000 in direct connect cash when we talk about assistance and helping our people. Vehicles, driving people, everywhere you look at, this is where we have been boots on the ground and making sure that our people are fine at this particular time. And that's kind of a wrap up just because for the sake of time. So thank you so much for asking.
Thank you, Sister Christina. And I know y'all see that she's in her car. Like, she's literally boots on the ground working right now, just taking a break to be a part of this conversation. So we really appreciate that. And lastly, Susanna, would you like to share?
Yeah, thank you. So I do volunteer for a few organizations, one being the Austin Latino Coalition and the other being the Del Valley Community Coalition. Both of these organizations advocate for issues that improve the quality of life in our community. Currently, I'm the president for the Del Valley Community Coalition, and we've been around for around 11 years. But last year, we became a 501c3 nonprofit, which has actually enabled us to provide a lot more services to our community. During the winter storm, DVCC, I call it DVCC, it's shorter, was able to bypass local government and then go straight to the vendors to get food and water for our community, which was essential in a time of crisis. In partnership with Tesla and our other community partner organizations like the Austin Latino Coalition, we were able to serve 10,000 residents in East Travis County by providing food trucks, meal kits, and water. And I just want to thank all of the community organizations that helped us get this out to our community.
All of the groups that you see here on the screen represent a concept that I'm learning more about, and it's called cultural responsiveness. And I want to frame this next question by talking a little bit about cultural responsiveness. This happens when programs and services engage and partner with communities in the design, delivery, and evaluation of effective and appropriate services. Culturally responsive programs are driven by firsthand knowledge and lived experience instead of cultural stereotypes or generalized assumptions. This helps create an informed understanding of the real needs, the real resources, and the strengths of diverse communities. So I've set up this question by talking about cultural responsiveness. And Daniel, I want to talk about how this relates to your group, the Austin Disaster Relief Network. Austin's changed a lot since you were first established in 2009. Talk about the original reason why the Austin Disaster Relief Network was created, and then tell us how your organization has adapted to the need for culturally responsible disaster relief in this diverse, growing community.
Sure. Well, the regional model was God inspired, but when we began to quickly research into what was going on in the greater Austin area, we found out that churches were not united. They were not working together. There was no plan in place when disaster struck. So it was a perfect time to do that. Since our forming, since 2009, Greater Austin has actually experienced 6 historic disasters and 10 major disasters. So it's really, it's a change atmosphere in the Greater Austin area. Prior to that, by the way, there was only 9 disasters from 1900 to 2000, and so that's how really our environment has changed also. But since then, we have been committed to work with the city of Austin and the greater Austin area to be able to meet the needs of everyone impacted by disaster. So regardless of their sexual preference, of their religion, of their background, their race, we're here to provide for every man, woman, and child. We are in the process of decentralizing our model, so where our network churches can actually work very closely in the community with their own cultural, and economic, social uniqueness that they are. And that's going to play a big part. Plus, over the years, we have found a big need for just opening up the door, not only to our volunteers to respond to, but to the whole community response. So we've created some new programs for just the average volunteer that's spontaneous, that may have not been trained with us, to actually be part of our response. And so we've opened up that door to what we call community volunteers. And so those are some of the ways that we have adapted.
Thank you.
Okay, I was having some technical difficulties again. Okay, so my next question is for Sister Christina. So we're going to piggyback off of what Daniel just shared. So as you witnessed through your work with 10,000 fearless first responders, our Black and Brown neighbors time and time again bear the brunt of the harm when disasters strike this region. We saw that with Winter Storm Uri, Hurricane Harvey, and the list goes on. What are the most common themes and issues you believe we miss when providing disaster relief services to historically marginalized communities?
Wow, that's an excellent question. And we miss quite a bit. We miss a lot of times we think about the quantity of things. We talk about the resources. It is resources. We miss resources, but we miss giving the resources to the teams to make things happen. We've been boots on the ground for several decades, just being out there teaching and training our people. But it seems like every time there's a disaster, our community. So as I started off in the beginning, I said that we focus on the people that look like us. Well, it wouldn't have to be a point because we help everyone. So I want to make sure that's absolutely understood. We help everyone, but it always seems like every disaster that I've been in and I've responded to disasters, we have across the world.
Sister Muhammad, you mute yourself.
Sorry about that.
Yeah.
Can you all hear me?
Yep.
Can you hear me? Okay, sorry about that. So as we start looking at the proper resources for our people, you know, I think about when I think about responding, our people are always left. They're left. When you think about Hurricane Katrina, our people are left without the knowledge, without the know-how, right? Taking accountability, and then the food that comes in. I can compare disasters that I see naturally, locally from across the world. I think about California when we went in to respond to the Woolsey fire. These were rich people that had lost everything. And I couldn't understand. I was looking at the food sources that people were giving the rich people. And when I talk about when we give food, I remember going in and if bananas had a small little stain in that, the interesting part in that wasn't fit for the people. Well, I think about the resources for my people, we just give anybody anything. Oh, well, go ahead, we'll get it from the food bank. It's gonna expire tomorrow. Let's just give it to our people, or this, that, and the other. The quality of food, the quality of help, the quality of love, the quality of empathy. I remember Hurricane Harvey. You know, everybody boots on the ground. We're going out there and helping our people. People are going in with the boats. So it's the people that had more monies, right? These big teams that had more monies would send anybody out. And I remember there was a group that was going out to do some rescuing with boats because they had money, and the team, we didn't have money, right? So they were going out, but the only thing was, it was the empathy. It was the lack of love for the people. So there were some of the people going out drunk. They were going out drunk saying that they were going to go rescue some of the people. And that was really, really sad to me. So I remember saying that. I said, you know what? I'm not just going to focus on just the quantity. I can talk about I have helped millions of people, but what type of quality have we given to the people? And that's the beautiful thing. Our people deserve to have the best of everything, just like everyone else does. And it does not have to be on a rush. We don't focus on our people, the people in the community on the east side, until a disaster happens. Well, if we can start prior to all of that, having something written out. You know, going into disasters for years, there's nothing written down how we're going to help our people when it comes to a disaster. And that's why we get to situations like this. Everything's a rush. Oh my God, what are we going to do? We got to hurry up. We got to get them off the streets. We got to do this. We got to do that. It does not have to be rushed. There should be something already implemented. So when you push a button, we already know what's getting ready to happen. And those are some of the things that we have been witnessing that we don't have. We don't have the proper resources. But the people that have boots on the ground.
Sorry, y'all.
Sorry about that. The people that have boots on the ground, the people that are out there working, those are the people that don't have resources. I remember just really briefly getting ready, having boots on the ground, going out there. We're called 10,000 Fearless First Responders for a reason, because you have to be fearless to do a work like this, a job like this. And we were one of the first people out there. People didn't understand, well, how are you out there? How are you able to go out and rescue people? We're rescuing people, but listen to this. Out of every organization that you can hear, I guarantee you every organization has money, has resources that they can allocate to go out and help people. But we did not. So what do we have to do? We were prepared. So we had snow boots, right? Snow chains to put on our vehicles. We didn't have the 4x4 trucks that we were asking people, hey, guys, we need some help. We were the group that was out there rescuing our people, but we did not have any of the resources that we need to get to our people. It's more than just food and water. We had abundance of food and water. Our people need to be able to have what everyone else has. And if we're boots on the ground, we have to make sure that we have what we need so we can make sure to get help to our people.
Susanna, I want to reflect on some of the big themes that Sister Christina just talked about, because I'm sure that they also relate to the situation that you faced in Del Valle. You know, in the past, the needs and experiences of neighbors in the Del Valle area have been overlooked. So grassroots groups like Christina's group, your group, community leaders have come together to form coalitions like the Austin Latino Coalition and the DVCC to respond to these gaps, real gaps in services that Sister Christina described. I want to look big picture now. So what should cities, for example, the city of Del Valle do to broaden collaboration with these grassroots groups and ensure that these underrepresented voices are reflected in those government responses and preparedness efforts?
That's a great question. Well, I mean, and I'm gonna be completely honest with you. It starts with acknowledging that these communities and these organizations even exist, and that there's an urgent need for basic human services like running water, like closer access to affordable, healthy foods, like healthcare facilities, viable mass transit. It starts with acknowledging that there's a problem in communities and finding equitable solutions that can help solve it, and working with these grassroots organizations that know the community, know what's going on, know where there's a colonial out in the Del Valley area that doesn't have water, that can't get, to their job, they can't get to a grocery store. So knowing where these things are and speaking with these organizations to get and find an equitable solution is a starting point. Um, we know that there's a history of neglect in these areas. And so for the city of Austin and Travis County to continue to ignore these communities is irresponsible and unacceptable, in my opinion.
Thank you, Susanna. And we'll dig deeper. I do want to talk more about the Austin Latino Coalition, but we'll give you an opportunity to share more about that later. But I want to follow up with Janice now. So the Community Resilience Trust brings together cross-sector advocates working to ensure that Austin's response to challenges like COVID-19 and Winter Storm Uri is equitable, effective, and sustainable. And so earlier you called out the fact that you are a white woman in this work. And so as a white woman in a position of community leadership, what does it mean to be a co-conspirator when working to amplify the ground level voices of greater Austinites most impacted by emergency situations?
Thank you. Well, first of all, it starts by recognizing the expertise and work of leaders like Susanna Woody and Sister Christina. They're boots on the ground. They have years of experience and a direct lived experience and relationships that go way beyond mine with people who have a direct lived experience. And so I think that it starts, first of all, it's my honor to be even in this space, like with them. My role, I see my role as to follow the leadership of groups like theirs. And basically, I've reorganized my life to help build a table that I'm invited to sit at, but doesn't belong to me. So before 2016, I saw racism as interpersonal, like it had something to do with my thoughts and the way that I treated people, which then exempted me from it. I, was a good liberal white woman. And it was after somebody held me to account for my specific role in a system benefited me and disadvantaged others that I had the chance to see that by denying that role, it actually caused harm to others. And so since that time, I've been on a path to see the dials and levers under my own fingertips, to do my own work so that that work doesn't burden people who don't look like me for my re-education, which will be lifelong. I'm like constantly relearning, like it's not going to just be a one-time thing. And then like really looking at those dials and levers under my fingertips to see which ones at their leadership and their consent can I move to make a difference and balance the scale. So that's the work that I do, and that's the spirit in which CRT was founded. And then, a lot of times that also looks like I can't do that work by myself. It was formed with many different perspectives, so we could all look together from various perspectives to distinguish where those are, because structural and systemism is complex and very specific. You can see it. There are nodes, like there are places where it happens. Like if groups like Del Valley Coalition, Austin Latino Coalition, groups like 10,000 Fearless, and many, many others are not invited to the VOAD calls, that's a problem, right? That's a big problem if they're not in getting on those calls. And that's not necessarily the fault of VOAD, right? That's not the fault of that system at all. It's a bigger, it takes all of us distinguishing where, and yeah, I think that's really all I think that's really all I wanted to say about that, but I appreciate the question very much, and it's an inquiry I'm always in.
Thank you, Janice. And I wanted to follow up by just sharing a brief definition of what we mean when we say co-conspirator. So co-conspirator means to make a deliberate choice to take on the consequences of participating in dismantling oppressive systems and to support and center people of color in the movement for racial equity. And even in a natural disaster, there are still inequities when it comes to city response and community response. And so it's important, to note that we are not taking away from one group by acknowledging these inequities and disparities. So thank you.
And I think acknowledging these inequities and its disparities could really rethink the entire model of disaster relief. And your groups are kind of proving that. And I want to drill down on that a little bit more. Dr. Samantha Montano of the Massachusetts Maritime Academy recently wrote, "As someone who studies nonprofits in disasters, I have to tell you, it's absolutely wild to see how mainstream messaging has shifted from donate to the Red Cross to local organizations and especially mutual aid funds in just a few years." So anybody can tackle this question. My question is, do you think that donors, volunteers, and nonprofits have really started to rethink how they give, who serves on their boards, how they receive relief services? And how is that a positive, and are there some negatives involved? I know it's a loaded question, but I think it's something we really need to talk about because the whole model is changing, and I think it's for the better.
I'll say something here. We have seen definitely that shift. We have found a lot of local businesses, national businesses, just people around the nation even, going away from kind of the big larger groups to go local because they know where the funding is going back to the people of those communities. And that's been a huge, that supports all of our ministries here, right? Those that are on this call right now. Without that support, we couldn't do what we do, boots on the ground. And so we actually love it. We love the shift, and we love that I can point to those funds and say exactly here's where they were spent to those donors also. I think that brings a lot of comfort to them, knowing that we're reaching every man, woman, child, regardless of color, regardless of age, regardless of anything, right? And that's what I think our donors today want to see. They want to see that their money was well spent, but it didn't go into some large national pot or even international pot. They can actually count the dollars, and we can prove where the dollars went.
And I know that others on the panel want to weigh in on this whole rethinking of the model. Susanna?
Yeah, I actually love it because like Daniel said, we do benefit from it, and we're able to tackle and to put the money where it's needed because we are from the organizations and we know the most needed areas and people. I like I said, I love it. And I know that our donors know and they see us when we show our videos and our pictures, like where their money is going. And we're able to, thank the individuals, not just the big corporate sponsors, but the individuals, and recognize how much we appreciate their donations, and that 99% of their funding goes right back into our community. It doesn't go to a CEO or to, some big wig executive that's going to be getting millions of dollars, while the people that need it are getting hundreds of dollars. So I love it. And I hope that more people will continue to donate to grassroots organizations like mine and those that are on the call.
Janice, I have to say, when this disaster happened, the first group I thought about was the CRT. And I love that trust is part of your group, because I felt very comfortable knowing that you guys were doing your thing and that you were boots on the ground in the right places, listening to the community. So talk about a little bit more about this model.
Sure. And if you don't mind, I'd also like to say, I think it's really important on the earlier question to remain skeptical about inclusion. because internalized whiteness tends to tokenize the leadership of the global majority rather than recognize the full spectrum of work and all the many, not just nonprofits, but smaller groups that are doing that work and bear the burden of response without the funding support. Reallocating that funding is going to be a very long path. So I think we should resist the urge to feel like we're going there too quickly. And people who look like me need to keep advocating for that and supporting it and getting out of the way when necessary. And that's part of our model is, so I'm here representing with the alignment of the group that I serve, most of whom don't look like me. And on our morning calls, for example, things we've done to build trust is, tend to wait and let others speak first. That was something that I learned from Fatima Mann, and we use it, and it works. We also have a practice of we prioritize the lived experience, and it could be different at any given time. But what that looks like is listening to take action, holding on any solutions. White people tend to have lots of good solutions and ideas that come really fast, and we think we know the answer a lot of times. And so we hold on that. If we offer support, we offer it on a consent-based model. So we move at the pace that the lived experience tells us is right for them. And that's the person who brings up the issue. And the other thing on funding, I just want to say, I heard Ms. Latrice Cook of Melge say recently that she deals with disasters every day. And she doesn't have time necessarily to write the grants or go show up at the fancy parties to get the funding. So we need to shift things so that people who have the power and resources come to her. And I think that's why our collaborative exists, right? And it's easy to, at any point, for someone like me to forget that at any point. So it's a constant redirection, and one that I'm glad to be part of.
And we might want to point out Latrice is in the criminal justice space and doing some amazing work there.
Absolutely.
Sister Christina, did you want to weigh in on this question as well? I know we have an audience
Yes.
question as well.
Yes,
Please
absolutely. My sister was definitely, correct in saying what she said. A lot of times we think that we know what people need, but we may not understand, right? We're in different places and different times. Some people, you and your comfortness may not understand the difficulty and the struggle. And a lot of the biggest things that I've said many times before, see, we don't just wait. 10,000 fearless first responders, we don't just wait to when a catastrophic event happens and then all of a sudden, here we go, and let's do it. Disasters happen every day. My people live in a disaster every single day. So if we're not utilizing these funds, some of us can sit up with millions of dollars sitting in the bank account. And you don't even realize that you're just waiting on one big catastrophic, and then you can just start throwing and chunking your money around. It's not just about that. It's about the love that you have for the people. And like I said, we've been working for so long, and you can look at our bank account and be like, wow. And see, your love comes from you. It comes from your paycheck, right? My paycheck. This is what I love for my people. So the teaching and training that I had to go in and to be able to get. But knowing that, I was in a situation one time. I'll just share this really quickly. We were working in a disaster with Hurricane Harvey, and we had went to Port Arthur. And there was a FEMA camp that was actually set up at a time. And Red Cross had given me a call and was like, hey, can you bring some resources? Can you bring some food to the people? Because of course my job was to go in again to find the people that, looked like me, who were in need and wants. And my question was, how did you, Red Cross, not have the funds or whatever you need to go get resources for the people that you all set up account for? Why do I have to go in there and get food, but you all are getting the billions and trillions of dollars, and we little grassroots, community resources, people like us, we use the community to give us monies and the funds that we need to get what we need. But why would I have to go in and start finding resources for you when all these people are getting all this money, right? You're getting all this money, but you're just giving, you're putting it, like I was listening to Daniel, he says that, people want to find out the receipts. Well, give us an opportunity to give receipts. We got receipts too. We have lots of receipts, right? It's just a political aspect. We have to move away the political aspect. And when you see people in need, remove yourself from that. I'm not on a salary. I don't desire to have a salary because when people are in need, this is a love from me. So we haven't even gotten that far. We have to be able to just look and say, look, let me let the people who is dealing with the situations deal with it. And if you have the resources, how can I partner with those that are boots on the ground to make sure that they have what they need so they can move forward and they can help the people as well? So thank you.
Thank you.
Thank you for that. So I want to encourage people to type in your questions. We got a lot of comments. Folks are really resonating with what's being said by our panelists. So thank you for that. So I'm going to go to our next question. And we know that social media has been big during this past year and rallying groups and getting the word out about certain issues. So I'd like you all to tell us how you utilize social media during the storm and the role it played, either positive or negative, when it comes to mobilization efforts and ground level actions. Were there any positive or negative benefits of social media? And we can go with Susanna.
Yeah, thank you. So social media actually played a huge role for the Dove Valley Community Coalition. With social media, we were able to connect with all of our community members from the different areas. One thing that I really love about social media is that pretty much everyone has a cell phone and they're able to connect to these different venues of social media. So when we, were busy over here in this area, we would get a message saying, hey, we need some help over here. And that enabled us to focus on the other area as well that we may have thought that maybe somebody else was handling. So I used it, we used it, we were able to host and share events. We were able to mobilize our volunteers by sending out links and saying, please sign up here. And that enabled us to get help with the distribution so that way we can reach all the different areas without tying ourselves and stressing ourselves and limiting our own abilities. So I thought it was a very positive aspect. There are some areas that we did miss because the internet service out there is not very great, but we, word of mouth, texting and calling people up saying, hey, how are you guys doing? We were able to reach those areas as well.
Did anyone experience any downside with social media? Like, do you see any negative aspects of it? Janice, I saw your hand up.
I don't know if it's so negative as a not enough. One of the things that we did, and we've a lot on AISD throughout the last year in a lot of ways. One thing that they did that we really appreciated was they used their robocall system to make some announcements about resources that we requested that they make. And it was really helpful because it reached folks that may have had their phone. And many people are connected by phone to social media, but they're not all in the same channels. So having a singular announcement that goes out to everyone in multiple languages made a real difference. So I feel like it's a great tool for coordinating. But because it does, I was born in 1992, so I remember phone trees, and I think there's a value there in that approach.
Thank you for that. Daniel,
I want to just say I loved how it empowered youth also. We saw a lot of youth doing fundraisers out there, even kids, and communication using their network. So it got everyone involved. And also when there was needs, we can put that need out there, and next thing you know, the supplies are showing up. So it's a phenomenal tool to mobilize, like Susanna said, people when there's desperation and need and quick needs, but also it's just a great way to get everyone to feel like they can be a part of it. And when disaster strikes, there's that time period where sometimes you can't deploy people just right off the bat because you're in response mode, you're in rescue mode. But with social media, they can start today, this moment. Now they can start dreaming up things with us and helping us solve solutions. So we have seen good things. There have been a few the negatives for us were some of the political stuff that we're trying to attach itself to it. and then it go off on its own tangent. And so we'd have to cut that off because it was taking the focus off of helping people. But that was about it for us.
Anything you would like to add, Sister Christina?
Absolutely. I did see definitely some positives. It was really great. Again, we partnered up with a lot of people, you know, in our community. And it was great because people were starting to tag you, hey, you know, 10,000 Fearless, I know you're here. We need help over here. We need water. We need this. We need that. And you're able to move in and to move out to assist a lot of people. So I was really thankful for it on that end. And, you know, and for me, you know, again, we talk about receipts. Social media is your receipts, right? You can actually see the work of what people is doing. It's not all about an admin book, sit there and log in things. If I can see the work that you're doing, a person should want to put their monies into a group, an organization that can work with the community, right? We work exactly with the city as well. Whatever we can do, how we partner up. So we were able to see what our District 1, right, Mayor Pro Tem, what she's doing, where she's at, what's needed. That was absolutely great. But again, like Daniel said, one of the negative forms that I see when it comes to social media, you know, because now you start looking at other community people. What are you doing? And envy, jealousy starts kicking in. Why do they get to? Why are they doing this? What's happening? So on and so forth. That was kind of the negative piece. You know, you had some positive people out there excited. Then you had those negative seeds were just like, man, I'm not doing enough. I don't know if I feel a certain type of way, or that organization is not doing enough. Like, you know, that's the part that's negative to me. But I think overall, just having that proper communication, it really did help. It helped us.
You know, when I was thinking during the emergency, my heart and my mind went to what about our neighbors in need who may be homeless or are non-English speakers or way out in rural areas and are hard to reach. What do you all think are some steps that community leaders and even local governments can take to be more responsive to the needs of those folks when we have another emergency?
I
tackle that one first. I know it's a loaded question, but it's an important one.
Yeah, I have a lot to say about that one.
Okay, so Santa, go for it.
So, and I actually spoke to a few of our city and county leaders, and they know how I feel and how disappointed I was with their response to the situation, especially in the Eastern Crescent, and how many areas were neglected. I guess my request to them is that as city and county leaders, you know, they get together and they come up with an actual emergency response plan, right? That encompasses the entire county. And then there will be a few layers within this, but the gist of it will focus on including, you know, evacuation strategy, hitting those communities that are marginalized, like our elderly, like our immigrant populations, like our disabled neighbors, and understanding that they are the first to need to be evacuated. And they're the first that need relief, and they're the first that need ongoing support. So identifying those communities and then coming up with this plan on how do we evacuate them, how do we provide relief efforts, and how do we provide ongoing services? And then working with local organizations that work with those marginalized communities to help get that process through and that plan executed. Hopefully that happens.
Janice?
Yeah, my answer is give Whitley a job. Here's what I mean by that. When we started on the 12th and organized a group, we heard from I'm so grateful, from Whitley, who is someone who's unhoused. She spoke in front of community leaders, including many city officials, and shared her experience. And she told us, yes, shelters are good, and many people won't go because they've had harm done in shelters. And if you want to actually support people in getting off the street, give them hotels. That will get them off the street. And so we did that. But, and I say we, I mean, it was the group, it was, 10,000 Fearless, We Can Now, Survive to Thrive, AMA, Austin Area Urban League, Mobile Loaves and Fishes. There were a lot worked on that. I probably have left some out, and I'm sorry. But she wants a job in social service. She was delighted to give that insight. And we should give her a job that leads that. I mean, literally give her a job. If somebody wants to support me in getting her a job, like, contact me. She should have a job leading that effort. And others like her.
I'm going to make mine quick. I know you have a few more questions here. I just want to say that where we're heading by 2024, our plan is to have a leader in every what we call sector, which we've broken the greater Austin area into 12 areas. We are going to put pods, point of distribution within those neighborhoods for food, for disaster goods and supplies, rather than our centralized approach now, where people have to come to maybe 1 or 2 or 3 sites. We're building leadership within each of those communities, and then will be empowered to have their own point of distribution centers for food and for goods and supplies, whereas the mega supplies typically comes in through the network, because we have a network of churches that attracts a lot of supplies and goods. We will put that right back into the hands of the community. So that way, God forbid, if it's a catastrophic event again, we got to prepare a city to be able to handle these kinds of broad, widespread events, because disasters are no longer the same. We have to think differently. So our whole organization's going through a complete transformation now to get ready for that. And we got to experience some of it during this disaster. So that's where we're heading.
Thank you. So we're going to go into our call to action, and I want to set it up by reading a statement from Gloria in our comments. Gloria says, these situations identified leaders in various communities, and we should look to provide those folks with a seat at the table. And so this is for everyone. What advice do you have for community members who want to get involved in disaster preparedness and relief efforts, but don't feel qualified to step into leadership roles? And I'll start with Sister Christina.
Yes, ma'am, absolutely. Everyone is a leader. There are so many different areas of town, so many different apartment complexes, so many different home neighborhoods. Everyone should consider themselves a leader. What do I mean by that? Because our whole goal in teaching and training is to make everyone see how they can become accountable. If everyone prepares, right, prior to a disaster, if you prepare, then you don't have to worry about you being one of those possibly, hopefully, right, that are in need at the time. That's why we teach our team. You have to make sure you have what you need, because a first responder has to respond first. You can't come second, you can't come third, you can't come fourth, right? You have to come first to be able to help. So everyone in the community, you are a leader. Now let's get trained. Now let's get trained. You have something called a community emergency response team. Now we're in that training. I've had so many calls. How can we go ahead and we become first responders? How can we help? You organize your areas now. And this is something that I'm saying, I'm coming for a seat at the table, because the work that we have done, there's no reason why we should be out of the loop now. I want to hear everything that's going on. You should want to hear everything that's going on. I don't want anybody else to plan for us. And what I mean by us, that's people of color. That's people that look like me. I want to hear everything that you have. We want to have something that's in writing, so we know exactly what to do and how to go out into the community and teach and train our people. So when disasters happen, we can be more of helpers than those that are victims.
Thank you, Susanna. I'm sorry, Christina, Sister Christina. Next, I would like to ask Susanna. I was thinking ahead.
Everything that Sister Christina said. And if you don't feel, qualified to like take that next step, volunteer with organizations that are doing, that are stepping up. No volunteer is ever going to get turned away from grassroots organizations. We can always use help. There's always room for people willing to put in the work. So just volunteer if you don't feel like you're up to that qualified next step leader position. That'll be very helpful as well.
Thank you for that. Janice?
Yeah, I echo very much what was already said. And I would just say that if you would like to serve a population that doesn't look like you or experience life like you, I recommend an organization that's led by those who do, and then follow their lead.
And Daniel?
It's the training that really helps us be able to help you, get you behind the yellow tape. And we offer 18 different types of disaster response training And we can empower kids too. I mean, I've seen kids get empowered in crisis intervention training and then go and love on another teenager in a time of disaster. There's no one better to reach out to a teenager than a teenager that's equipped and trained. And that's, by the way, from even the elderly. We need you too. There's jobs for you that we can empower you now at home. You can be part of our call center by just getting trained and us giving you the equipment that you need to be able to do what we need you to do in times of crisis. So really, like Sister Christina said, everyone can be a leader in a disaster response. There's a part for everyone. So we'd love to see everyone be part of it.
Thank you for that. And we didn't get a chance to like delve into the different coalitions and groups, but for those who registered for this program, we will be sharing a follow-up to links to all of the groups that were represented on the panel, as well as some upcoming events that will be held by the Black Leaders Collective, Austin Latino Coalition, the meetings and links from the Community Resilience Trust, as well as upcoming events from the Austin Disaster Relief Network. And we'll connect you with 10,000 first responders so you can know how to stay connected with, engage with them as well. And Judy, you want to take us out?
Yeah, did we have a call to action from Sister Christina? Very good. Okay. Well, we just want to thank all of the panelists today. You guys were wonderful. You shine the light on so many important areas of disaster relief that I think a lot of people didn't realize was going on behind the scenes. And I, for one, thank all of you for these efforts. So once again, thank you to Susanna Woody, Christina Mohammed, Sister Christina, Daniel Gerasi, and Janice Bookout for sharing your insight and all the experience that you had during this disaster and beyond. And we also want to invite everyone to watch next month, because we're going to be talking about quality of life for the LGBTQIA community in Austin. So thanks again for watching, everybody out on Facebook. Please share this conversation. It's an important one, and try to make it a good day out there.